All right, we're going to do ankle wraps next. Okay, this can be used for a variety of patients. It's going to offer some really good medial to lateral support. You're going to put 2 of them on the patient. Okay, I want you to note though, the 6-inch ones that are about this size, that's a good size to use. Don't use the little skinny ones because they can tend to cut off circulation a little more. And another thing to look at, you don't want to use one of these that's supposed to go like all the way up the leg. Okay, that's going to be too much bulk. Okay, so this size are the size wraps that you want to use. Can I have you hold that one for me? Before we get started, we need to know if we need to just put her in neutral position or if we want to put her in dorsiflexion with eversion or dorsiflexion with inversion. Okay. We'll do neutral so you can see me do it in both directions. Okay. All right, so hi patient, how are you today?
Pretty good.
Good. We're going to get you up and walking, but I know you've been having some problems with that foot, kind of dragging a little bit. So we're going to use the ACE wraps here to hold it up until your brace comes. Okay. So I'm going to have you bring your foot right up here. Okay. And I'm going to do one in one direction and then one in the other direction. So first thing I'm going to do is just kind of get it anchored somewhere, and you can anchor it wherever you want. Okay, so it's anchored. Okay. And then what I'm going to do, are you comfortable there? Mm-hmm. Okay, so I'm going to bring it down. As I'm coming down, it should be loose. Okay, so this is nice and loose right now. You can't get rid of these wrinkles, so don't worry about these wrinkles. However, across the bottom of the foot, you want it to be flat. You don't want a lot of wrinkles across the bottom. Okay, so if you can get it fairly flat there, that's going to be great. So the first one, I'm pulling her up into dorsiflexion and a little bit of inversion, and this is going to be tight as I come around until I get it behind the ankle. Then I can let go with my hand and then bring it loosely down. I'm going to bring it to a different spot on her foot. Okay, as I come up, I'm going to pull tight into dorsiflexion and inversion. Okay, once I get it behind her ankle, I can let go with my other hand and bring it down softly. Okay. Here, again, I'm going to pull tight coming up. Find a different spot here. And loose coming down. And again, tight coming up and loose coming down. Now this one I'm just going to kind of tuck underneath because I'm going to be doing another one in a second, and that'll lock it down. The final one, when I get it done, I'll tape. Okay, you can either tape or safety pin. Really shouldn't use, those little silver things that usually come with an ACE wrap, especially with a patient who has paraplegia. You don't want to use those because if that gets underneath them or something, they can't feel it, and it can really damage them, and those things fall off all the time. Okay, so it's better to use a safety pin where it's actually clasped on, or you can use tape to hold it on. Okay, so that time as we came across the bottom of the shoe, it went from lateral to medial and pulled her up into inversion with dorsiflexion. So this time, if I want her neutral, I want it to go the opposite direction. Okay, so I want it to go from medial to lateral as we go around. Okay, so with that in mind, I'm going to go once around just to anchor it. Okay. Coming down softly. As I pull up, this time I'm going to pull up on this side of the foot to push her into eversion and dorsiflexion. Okay, so pull tightly here. Okay, I can hold her using my chest, using my shoulder, whatever I want to use there. Pull it tight and then loose coming down. And again, I'm spreading this along the whole foot so she doesn't have all the bulk in one place. Tight coming up again. Loose coming down so we don't break up or cut off circulation. Okay, and I'm just about out here, so I'm not going to pull this one tight because it won't stay with the tape. Okay? And I would tape at the end with fresh tape. This tape's getting a little old, so it may not stick. But okay, so you see how I did that? As I came up from either side is the hard push until I got it anchored around the back of the ankle, and then soft coming down. Okay? Make sense? Okay, we can turn off the camera.